Good afternoon, everyone. I'm Cristian Bușoi, member of European Parliament, Chair of Industry, Research and Energy Committee, and European Parliament Rapporteur for the Health Programme, EU for Health. I hope my signal is good because I'm in Rome. I participated to a EPP important event, and I'd like to welcome everyone on this very important discussion about the opportunities that Romanian health system will have in the context of European cancer beating plan. Once again, thank you for being here today. I would like to thank the organizers and also the distinguished speakers for accepting the invitation to spend some time with us in this afternoon. Because despite efforts to reduce the incidence of cases in Europe, cancer remains one of the main challenges affecting citizens and the society as a whole. And according to European Beating Cancer Plan, we'll discuss a little bit more about this extraordinary initiative soon. 40% of the cancers are preventable if we implement good cancer plans and screenings. Moreover, we should put the issue in the context of the global pandemic of the coronavirus disease, which continues to have a serious impact on many people, but also a very serious impact, unfortunately, on cancer patients due to their increased risk of serious illness from an infection, but also, of course, due to some barriers in order to receive the diagnosis and treatment correctly. Currently, we are facing also policy gaps between the member states. Many member states did not update their national cancer control plans in the last 5 years, and 19% of the member states do not have a national cancer control plan at all. Unfortunately, Romania, and we'll focus today to Romania in the context of European initiatives, Romania is one of those countries. Moreover, it is well recognized that cancer is often diagnosed late, which means that less treatment options are available for people impacted by advanced diseases. An earlier diagnosis means also a reduction in healthcare burden, and of course, this is something extremely relevant in the context of the necessity to have and to assure the sustainability on the medium and long term of our healthcare budgets. It is also recognized that the research in the area, even that we made progresses in the last years, but is still limited, and also that the fragmentation of innovation translates into lack of new therapies or innovative treatment. But, and I will finish with this, cancer is now a priority for the Union, health is a priority for the Union. At the European level, we already have tools at our disposal to achieve the necessary level of progress in this field and to contribute to our primary and final goal, that of eradicating cancer. The tools are the European Cancer Plan, Horizon Europe Cancer Mission, the EU for Health program that will support fighting cancer in synergy with other financial instruments, will support the European Beating Cancer Plan, but also a series of other actions to fight cancers or to improve access to treatment, screening, or other care, including palliative for cancer patients. Of course, we have also at our disposal the cohesion funds and also the recovery and resilience facility. The member states are invited to invest part of this money in their healthcare systems. And of course, fighting against cancer, it is a priority here. We'd like to concentrate today to some of the challenges and inefficiencies of the cancer management, but also to identify the concrete actions of European Beating Cancer Plan and how they could be implemented in the Romanian Cancer Plan and the extent of the European institutions' support, concrete funding opportunities for initiatives in Romania in this direction, and European criteria for centers of excellence and how they can be implemented in Romania. I would like also to thank Dr. Pana, my co-moderator. At some point, I will kindly ask him to take the leadership of the meeting. Of course, I will be here until the end. And I would like to thank Mrs. Alina Kulcea. She's the chair of Romania Association of International Pharmaceutical Manufacturers, RPIM, to Mr. Cristian Hotoboc, chair of the patronage of private medical service providers, PalMed, to Dr. Adrian Udrea, also from PalMed, to Dr. Andrei Baciu, the state secretary in the Ministry of Health, which will join us soon. He's in the office of the Prime Minister, and he will let us know when he will be ready. To Professor Dr. Christine Comien, Vice Chair of the Board of the Cancer Mission under Horizon Europe. To Mr. Adrian Pereș, Head of EU4 Health Task Force, extremely important for Romania. To Mr. Matthias Schuppe, Cancer Team Leader for the Europe's Beating Cancer Plan Task Force, European Commission. To Dr. Ralph Harold, Senior Scientific Officer in the Task Force Regulatory in European Medicines Agency, and to Mrs. Hilaria Gianico, Secretary General of the European Union of Private Hospitals. I would like now to invite Mrs. Alina Kulcea to take the floor for some introductory remarks.
Thank you very much. Good afternoon to everybody. And I would like to say that I'm glad and honored in the same time to be present today to this such an important event for the patients, for the cancer patients. And I think the EU mission is one of a very special mission that we can all contribute. So thank you for the invitation. Like you mentioned, Mr. Bușoi, we have to refer somehow to the COVID crisis. This is anyhow affecting our lives still, unfortunately, and we have realized that this crisis has reminded us about the crucial importance of health for our societies. We have realized that health threats have no borders, and that all these challenges can only be faced if we work together across borders, across sectors, no matter the industry and even no matter the country involved. That's why this event is so important for all of us. And I think cancer should be definitely a priority on the agenda of the EU institution, especially in these times when pandemic has disrupted access to screening, early diagnosis, treatment for all oncology patients. At the same time, we believe it's critically important that a strategy should be translated into clear and operational objectives, particularly for countries that have the greatest gap. I'm afraid I need to mention that Romania, despite our wish to be out of this country bunch with the greatest gap, I think Romania is still there. And for a good management of oncological patients, EU should offer all kinds of support in terms of training, sharing good practices, and even financial support if necessary. The impact of this pandemic severely hit the Romanian oncology patients. And I have just a few data from a recent study that was published by FPIA in collaboration, in partnership with PricewaterhouseCoopers, that I would like to share with you today. They are quite important and quite significant. Just to let you know, in the first quarter of 2021, there were diagnosed more than 12,000 new cancer cases. There are overall more than 500 cancer patients that are included in the national healthcare system. And between 2019, since the pandemic started, and 2020, the number of newly diagnosed cases decreased by 12%. But COVID impact was even heavier on the hospitalization of cancer patients. From this data, by August 2020, the number of national cancer hospitalizations decreased by 46%. It's quite dramatic, I would say. And if we are referring now to the cost, to the spending on cancer, according to another study that was published in 2020, the name of the study is Cancer Cost in Europe, we could recognize that Romania is far beyond the European average on spending on cancer, which is around 378 euro versus Romania, where we are around 160 euro. When we refer to per capita healthcare spending on cancer, not including the cancer drugs, we are below 50 euro, we and Bulgaria. Just to have a benchmark, maybe not the most relevant one as we talk about Switzerland, but just to compare, Switzerland has more than 500 euro allocated to that. So we are still, unfortunately, very much behind some important KPIs. And thinking about access to innovation, in 2020, the Romanian cancer patients had access to innovative medicines approved by EMA just between 2016-2019 as an interval of reference, in 874 days. If we are comparing to the EU average, there were 560 days over there. So again, very much behind some important indicators that we need to continue to measure. And just to kind of conclude with that, from 41 oncology drugs approved centrally at EU level by EMA, in January this year in Romania, there were only 12 reimbursed. I don't want to mention any more about clinical trials. Unfortunately, we all know that in Romania, the clinical trials are quite behind the schedule. And we can mention that despite the 60 days legal approval framework, we are lagging behind probably with more than hundreds of days. I don't want to say exactly the number because this is really putting us in a very ashamed situation. As an involved partner to patients and healthcare professionals, RPM being the voice of the most important 27 innovative pharma companies, we have been very involved into the European Cancer Plan, into the National Cancer Plan, and we have launched 2 major projects so far in partnership. One of it is the OncoPatient Journey project, which is launched with the support of an important local expert. This one is meant to describe the patient pathway in Romania for the 10 most important cancers, either 5 solid tumors and 5 blood cancers. And the intent of that is to compare it with the best practices in Europe to be able to help authorities to formulate the best policy recommendations. In the same time, we were involved into the campaign Together We Beat Cancer. And this is an awareness campaign launched by a famous magazine in Romania, Politici de Sănătate, together with the RPM Oncology Working Group, where we are focusing, of course, of the importance of launching a national cancer plan. Behind this is a coalition of all important stakeholders, all actors that are critically important to be part of this coalition. And just to name a few proposals that this coalition is already having for the authorities, and then I can conclude. The most important one is to finalize the elaboration of the National Cancer Plan, for sure, and include what I'm saying about the 10 most important, most burdensome pathways, cancer pathways for the 10 oncologic pathologies. The other one would be to accelerate the screening programs and include, of course, important financing and the monitoring mechanism. In the same time, we need to elaborate clear oncology county maps, where we need to include all the hospitals, either private or public, with the services provided for each county to be, easy for any oncologic patient to recognize where and how he should be treated. Last but not least, providing clear terms for the updating of the reimbursement list. We know that we have had some progress here. We have opened up the reimbursement list in Romania quite significantly in the last years, but still we do not have a very clear terms for patients when this list is going to be again opening up for them. That is important to have on the legislative framework, and also to maybe operationalize the collection of the real world evidence to speed up the access to innovation and diversify the mechanism, the managed entry agreements that could allow more innovative mechanism to be available to the Romanian patients. That's all from our side as a kind of a few recommendations that are critically important to happen pretty soon. And we are offering, as always, all our support, involvement, and partnership to all that are involved in this important mission. Thank you.
Thank you. Thank you so much, Elena Kulcea. Thank you also for the involvement of RPM in making the stakeholders to understand better the momentum, the need to go in the direction of EU Beating Cancer Plan and to use all the opportunities in order to improve the situation of the cancer patients. And now we go to the PALMED, to the Association of the Private Medical Operators in Romania, hospitals, radiotherapy centers, imagistic laboratories, which are extremely important not only for the screening, early detection, but also for the treatment of the cancer patients. And I will kindly ask Mr. Hotobok to introduce and also to update us with the situation, the current situation in the context of COVID-19. Please.
Thank you very much. Thank you very much, Christy. And thank you everybody for being here with us today. I will make a short introduction, and then Dr. Udrea will make a more elaborate presentation because he's the specialist in this field. So, if we had this discussion 3 years ago, the coronavirus pandemic would not have been part of the problem. Now the whole situation has to be adapted to the new context. The pandemic has disrupted healthcare services and led to situations where diagnoses that could have saved the lives of many patients have been missed. The private sector has adapted most quickly, I would say, and most effectively to the context of the epidemiologic situation caused by the spread of SARS-CoV-2. According to the data from the latest annual report of the National Health Insurance House, private hospitals have made the most significant changes in their structures, and the number of the beds and the national level increased by 5.49% in 2020 compared to the previous year, and also the number of contractable beds increased in 2020 by 1.65% compared to also with the previous year. So this means that in spite of the COVID pandemic, the need for treatment is very high, and we had to adapt to these new solicitations from our patients. About cancer and about screening programs, I can tell you that screening programs for early detection of cancer should become a priority. Unfortunately, at the moment, there are no such programs at national level in Romania. There are, however, private initiatives of various healthcare providers which are supported by their own funds. And here I will give you an example about one of our members, a hospital in Constanța, that developed a new platform to detect new cases of cancer and to treat the patients from early stages. Also, the medical subscriptions offered by the private providers help a lot in detecting the certain forms of cancer in early stages. So from our point of view, we are making all the efforts that we can in order to prevent the new cases of various cancers. Romania has among the highest mortality rate in Europe for the most cases of cancers. An infographic published on the Ministry of Health website shows that in 2020 in Romania, according to a study by the International Agency for Research on Cancer, more than 98,000 new cases of cancer were diagnosed and more than 54,000 patients died. So this is not very good figures, and I think we should start to do something. And I think this meeting today is very important to really start doing something. In the end, I will tell you that Palmet has been and continues to work in two main areas: the implementation of patients' personal contribution and also the implementation of telemedicine, which could also have a positive impact on cancer management. I think Dr. Udrea will tell you more about his latest work from the last period. Also, patients treated through telemedicine. Thank you, everybody, and I think we'll have, and I hope we'll have some good points after this meeting.
Thank you so much. And you're right. This meeting and other meetings are extremely important to start doing something very concretely. And also, today's meeting is important because we have the chance soon, after the presentation of Dr. Udrea, to understand better what are the European opportunities. You mentioned telemedicine. Monday, we had here in Rome a dialogue with video dialogue with President von der Leyen. She's in New York at the UN General Assembly, and she explicitly mentioned the digitalization in health, the creation of European health digital area, and when I asked her about the need to use the digitalization in order to create a health union, she expressed again the strong commitment that digitalization in health and telemedicine is, of course, an important part, but not the only part, will be a priority for the future. And also for cancer patients, the digital solutions could be extremely useful. I go to Dr. Udrea now, and I kindly invite him to take the floor. And then we go to our Brussels and Amsterdam guests, so European institution guests. And after that, their presentation will have also question and answers, short sessions. Just an announcement, because we have an audience, two kind of audience, one a large one on Facebook and on European website in Romania, but we have also a Zoom invited audience, and their question will be transmitted to us, to me, and then to Dr. Adrian Pana, and I will kindly pose this question to the distinguished guests. But before going to that moment, Dr. Udrea, I have the floor.
Yes, thank you. Let me introduce myself. I used to work for 20 years in a public hospital, and the last 11 years with my family, we own a Center of Excellence in Cancer in Cluj, Romania. So my presentation is going through a short overview. I'm going to share my screen of cancer patients in our country, access to screening, diagnosis, treatment, and follow-up, including some of the COVID period problems. Oh. Oh, okay, sorry. So the first slide is about questions that I think should be the departure of my presentation. And first, I listed here patients' needs about the disease management, education of the patients, of what they should know of the process, the psychosocial support, and the fact that we still don't have national guidelines like European Society Medical Oncology, or ASCO or NCCN, which are the American counterpart. Now, the next question is about staff, because, well, we know that we have very good schools of medicine and we can form oncology doctors, but what about the nurses? What about the pharmacy, oncology pharmacy? What about the psychologists, secretaries, and all this stuff that we need in public or in private to work with for every day? This was a problem during COVID pandemic and still is, because a lot of training that was done for nurses, for example, cannot be done in online. Now, a very important question that I'm having everyday discussions about is about the quality control, because I think that everything that we do in everyday practice should be controlled in some way. And especially in oncology, where we all know that sums are enormous that we spend in national reimbursement every day. But the quality, I think that the quality control is still lacking. Now, the public versus private, the difference between this, I think that everyone can ask in every European country. So as mentioned before, we don't have prevention, we don't have screening. So I don't have to talk about this because we cannot do it. We do it as Mr. Hotobok said, in some private practices, also in public practices eventually, but not at a national level, organized national level. So what about the diagnosis and molecular profiling? The multidisciplinary disease management, because there are some, I would say, legal problems there also. The follow-up, and again, I put it here, the quality control. Now, if we are talking about diagnosis, we have big problems because due to the lack of specialists, and I listed here in radiology, for example, senology, computed tomography, MRI access to competence is restricted, even if not speaking about pandemic. In pneumology, which is very important, we know that smoking is still very important in our country. So bronchoscopy access to competence is still very restricted. These two areas are posing very important problems because we cannot diagnose patients. Now, there is no reimbursement for part of the procedures. For example, bronchoscopy still today is done without anesthesia. In public hospitals, I'm speaking. Now, during the COVID pandemic, of course, diagnosis services, we all know, a lot of them were closed. So, as I said, also training for competency not done online. So, but this, I think, it's a problem for whole Europe. Maybe other countries did better there with the organization. We had big problems, and I'm talking about a big city, which is Cluj, where, for example, pneumology was closed, bronchoscopy couldn't be done at all for patients who needed them. Couple of days ago, we had the European Society of Medical Oncology Congress, and I'm showing this map that was presented there. And we can very well see here that we still have some access to medicine. We are in yellow. But when we are talking about biomarker test access, about multi-biomarker test access, and about test quality, we are in red. And it's, I think, only us and Bulgaria that are in red. And this is also a big problem because I think that all this medicine where we spend so much money should be done only by the biomarkers. We know that the biomarkers are the test that we need to know if a certain treatment is going to have a good outcome or not. Now, the next slide that I'm going to present is also from the European Society of Medical Oncology Congress a couple of days ago that emphasizes this problem of biomarkers, where we can see here that the progression-free survival is according to the biomarkers that we are doing for certain treatments. And this is a graph on metastatic breast cancer patients. Now, we had this American Society of Clinical Oncology certification in 2018, and this year we will be recertified. And of course, everyone would ask us, why did you choose this kind of certification? We have ISO, we have other, and of course, an MHSA, which is mandatory in Romania for reimbursement. We have an MHSA, but we also wanted to have this certification because it's very practical. And especially for what we are, when we are talking about oncology pharmacy, where we know that the legislation in Romania practically does not exist. And also for training of the nurses and other personnel beside doctors. Telemedicine, yes, we now have the possibility to do consultations, prescriptions, but the lack of digitalization, we don't have electronic medical record in this country almost at all. We cannot speak about telemedicine, and especially in oncology, where we have to have multidisciplinary decisions and quality control. So I think that we have to begin there. If you ask me if I can do something from a political level, I would say you want to do something in Romania, you have to do digitalization first. I'm going now through multidisciplinary disease management. Now, this is a big problem because almost all Western countries have to have multidisciplinary tumor boards in order to have the best decision for a cancer patient. This is not mandatory in Romania for reimbursement. Expensive new drugs access is possible because we have the National Cancer Plan, but then therapies outcome are not controlled. And this is due to lack of reimbursement for molecular testing, for imaging and lab tests. Genetic counseling is non-existent. There is a lack of specialists and reimbursement restrictions. For example, we have a psychologist that has a European Society Medical Oncology diploma, but is not reimbursed because he's not a doctor. Radiation oncology, which is very important, and it's also very cost-effective at all stages of the disease, is still lacking despite new private facilities. It's a very obsolete legislation regarding personnel. For example, we still have the legislation that personnel in imaging or radiology or radiotherapy should work only 6 hours. So also stereotactic radiotherapy, which is now in all European and American guidelines, are not reimbursed at all. There is no legislation for oncology pharmacy. I already said this. We are a member of the European Society of Oncology Pharmacy, but we have to recognize that still hazardous drugs are being prepared at the patient beds in some hospital. This is unacceptable at the European level. This is my last slide, and it shows our medical record and digitalization at our clinic. I'm in Bucharest now, and I can work from here. I'm doing consultation with my patients because I can access the electronic medical record, which is somewhere in my town. All the administration can be seen here. Everything that we have to work for every day, everyone in the clinic can work remotely. So we are an example that we can. I would like to thank you, and I'm open for every discussion or collaboration for every one of you that think that I can help. Thank you very much for listening.
Thank you so much, and thank you for putting into the perspective of Romanian realities the need to build a cancer plan. So we already had the situation of what is now the Romanian reality for the cancer patients. The situation have to be improved. The access to treatments, innovative, but also to essential drugs. The need to better diagnose, to have the genetic text, to have a multidisciplinary approach, to find the specialist in order to have them ready for the diagnosis and also for the treatment, and of course to invest more in the screening and prevention. Now we go to see what are the opportunities, what are the main directions at the European level, what are the financing opportunities. I see Dr. Pereș already starting. I think first we had Professor Șomien, but if you like, yeah, okay. So in our agenda, and I hope I'm not mistaken, because the State Secretary, Dr. Baciu, is not here with us, he will be at some moment. We have Professor Dr. Christine Șomien. She's the Vice Chair of the Board of the Cancer Mission under Horizon Europe. I was not only the rapporteur for You for Health program, but also even before being the chair of the ITRE committee, the committee responsible for Horizon Europe, I was the rapporteur for opinion on behalf of ENVI committee, so for the health part of Horizon Europe. And here we fought a lot to have the mission for cancer. The mission for cancer, very clear as a strong political priority, even before the program was approved. Other missions are possible, of course. They could be discussed, they could be approved. But among a few missions that were decided by the co-legislators, the unique mission in the health area is the mission for cancer, giving the strong signal that cancer will be one of the most important priorities of research initiatives and research budgets under Horizon Europe. And we have a very good, extraordinary board. I had the chance to talk with a lot of the distinguished professors and extraordinary experts that are working in this area. And for Romania researchers, Professor Șomian could sum up the main initiatives and opportunities. You have the floor, and after your intervention, of course, if there are questions, we'll open already the discussion. The panelists will have, of course, priority, but as I said, the audience could interfere via written answers, questions, and I will write it and read it and kindly ask the guests to answer. Professor Șomian, you have the floor.
Thank you very much for this introduction. And yes, I'm happy to have this meeting with you, not directly at the Parliament or in the very specific meeting, but in the member state, and to answer a specific request of one of the member states, and that's Romania. So I'm very happy to be here with you today. Yes, I think that, as you've said, we have this unique opportunity which is presented with this European Commission to tackle cancer. We have the Beating Cancer Plan, and we also have the mission on cancer. The work that has been done by the experts of the Mission Cancer Board and the Assembly for more than 2 years, I'm happy to say, can now actually be seen as concrete delivery of what we recommended, both with the European Beating Cancer Plan and also, as you will very soon see, probably tomorrow or a bit later, in the actions of the implementation of the mission on cancer. The opportunity is that, as you all know, cancer is very complex. Not only the cancer cell, the more we understand it, becomes very complex and its environment in the body, but also the fact that the patient, the citizen, all the stakeholders that are present to fight cancer makes it very complicated. It's not only the physicians and the nurses, but as it was said previously also, it's the psychologist, the psychiatrist, it's the economist, it's the mathematicians, it's the physicians, it's the school teachers, it's everybody. And so the mission approach, which was a way of programming research or of tackling what each citizen face as a challenge by bringing together all stakeholders to answer the question, I think is very appropriate to fight cancer. It really shows us a new way, which is modern, which is not only now linked to the mission approach, but more widely accepted, to bring everybody together to really tackle what is necessary, and with a very precise and clear target and way of monitoring. So I'll try and highlight a few of the things which are for me crucial. I'm not only the vice chair of the mission cancer, but I've also been very closely part of the French third national cancer plan, and of course the future preparation of the strategic plan, which is now in place in France. And I can really testify of the importance of national cancer plans to be able to provide this framework where all the stakeholders sit at the same table, have all a responsibility to make the program move forward. We each had a specific task, which was, of course, linked to our specific expertise. And I think this close monitoring of every successes, but also of every difficulty, allows to move forward in the fighting against cancer. It's just not one ministry, It's just not one institution which is responsible. All the stakeholders are responsible together for the National Cancer Plan's success. Now, in the mission board consultancy preparation, we, of course, needed to talk and listen to the patients and to the citizens. The mission approach really says that we have to answer the challenges that the citizens and patients face. So it's not because we are experts. It's not because we think that we know what the patients and the citizens want. I myself, even though I'm expert, have sometimes been surprised of what I have learned by asking a patient or asking a citizen what he believed needed to be done. So I think the mission really stresses how important in the stakeholders, the patients and the citizens have to be present. They're not there at the end. They're not there just at the end of the table, or even worse, by the wall, because there's no place for them at the table. Citizens and patients have to sit right at the beginning to define the questions and to be able to move forward. I think it's important. You were talking about, of course, quality care. This is something that the citizens and the patient put up front. They also require to have access to innovation, access to information. And so I think that out of all the actions which are really coming out, and this is something which I find very positive, that the work that we have done with DG Santé and DG RTD have really now, as soon as this year, and it will be delivering more and more, concrete actions which will be funded, which will be able to help different countries to access to this quality care for patients. We have the comprehensive cancer centers, which is provided by the European Beating Cancer Plan. We prefer also at the mission board to have the cancer comprehensive infrastructure. It's a small difference of the terminology. It's just that it brings a bit more with the infrastructure, the need to include research and the need to include universities and training at the level of the Cancer Comprehensive Center. And we provide the necessity of twinning between different countries so that the progression of these quality criteria can be achieved progressively with the help of different types of other cancer comprehensive infrastructures. And I think what is really crucially important is the fact that all these actions will be done by men and women. And therefore, it's important that all the stakeholders understand the need of capacity building. It's not just the skills which are necessary, it's the number of people who are there to tackle the problem. And this, even for a country like France, and it's for all the levels, it's important that the stakeholders understand that cancer has been transformed. There are different needs, and therefore we need different types of people and more people. And I'll just finish and I'll answer questions. It's important also that we understand how crucial prevention is. We have seen it also with the COVID crisis. Understanding what a risk is important. Our children need to be targeted. They're the future generation. And like everything that we do for the training for our own children, the maximum is done before 7 years old. And I believe it's the same thing. They learn about climate, they learn about pollution, they learn about plastic in the oceans and in forests. I think it's also important that they hear about tobacco and that they hear about dieting and about physical exercise and etc. with the same importance. And so for me, going to the communication phase of reaching out to these young children is for me absolutely important They even can reach out to their parents saying, why do you continue to smoke? Or why do you continue to drink so much? So I think it's important that we also reach out to the information and to the schools. I'll stop there. Thank you.
Merci beaucoup, Professor Chomian. Thank you so much for the presence, for the contribution, for explaining a little bit more what are the most important directions of the Mission for Cancer, and of course for reminding us the importance of the National Cancer Plan, and the French National Cancer Plan could be extremely important and inspirational for Romania. We scanned some of the national cancer plans in Europe, of course, the French, the German one, but also from the Central and East Europe. And some of the most important ideas will be then presented to Romanian authorities. But this will come a little bit later. So Mission for Cancer and the calls under Horizon Europe for research in the cancer domain could be a good opportunity also for Romanian professors and academics. And of course, we encourage and we try to spread the information and encourage them to participate in consortium, or of course to apply to these opportunities. If the panelists would like to have now a specific question, or looks not the case, and not yet on the okay, I think there is one, but I don't have it on my screen. I will come back after the next presentation, and I go now to Dr. Perez, to Adrian Perez. I was extremely happy to find out that one of the key persons in the European Commission, in the EU for Health program, and of course the head of the EU for Health task force is a Romanian, and we count a lot on his advice and expertise, and I kindly invite him to present the opportunities from EU for Health program to Romania. Please. Mr. Perez, we cannot hear you.
Yes, I think now you can hear me.
Yes, very good.
Thank you very much for the introduction and for the invitation to participate in this event. I'm very happy to share with you what the European Union has made available at union level for health for the next 7 years. What we have in the EU for Health program, and we have this program also thanks to you, Mr. Bușoi, and to the skills you showed in the negotiations. So I have to recognize that publicly. We have more than the response to COVID-19 crisis. This is an ambitious vision that goes beyond crisis to support national health policies to strengthen and modernize their health systems. It comes with a big budget, 5.3 billion euros for the next 7 years, out of which a big amount is already forecasted for cancer. So this budget envelope comes with some conditions, and a minimum of 20% of the budget envelope needs to be spent on disease prevention and health promotion, including cancer. And there are some ceilings for spending on complementing national stockpiling of essential crisis-relevant products, as well as supporting global commitments and for the administrative expense. The regulation has been adopted early this year, and following that, well, the objectives of the regulation are very simple: improve and foster health in the Union, protect people from serious cross-border health threats, improve access to medicinal products, medical devices, and crisis-relevant products, and last but not least, strengthen health systems. These 4 general objectives are fleshed out in 10 specific ones, and I would like only to highlight 3 of them. The first one is disease prevention and health promotion, which touches upon cancer, complementing national stockpiling and establishing a reserve of medical health care and support staff. This required to be implemented in synergy with other union instruments, programs, and funds. But briefly, how does it work? So the regulation is requiring the Commission to adopt annual work programs, and that is done starting with the input from stakeholders. We are collecting input from stakeholders on which we are building in designing strategic orientations and priorities. We consult the member states in the EU4Health steering group. We inform the Parliament before that process is completed. And then with a positive opinion from the member states in the program committee, the Commission can adopt the work program. So we are going through that process every year. And for 2021, less than 3 months after the adoption of the regulation, we have managed to adopt the work program for 2021. That means about 300 million euros are available for actions in health at union level. We have already, the next day after adoption of the program, we have launched the first calls with 5 topics focusing on cancer. During the summer, we were working with the member states for the so-called joint actions, where member states participate together and they implement actions together. And in autumn, we will launch other calls, 13 topics, out of which 8 are on cancer. And this presentation will be available later, and I would invite the listeners to go to the funding opportunities portal to understand better those opportunities. And my colleague Matthias, he will also explain the more specific topics. Meanwhile, we have started working on work program 2022. So annual work programs are usually adopted the year before implementation. Now, due to crisis this year, we didn't have the choice but to run processes in parallel. We are aiming to adopt work program 2022 still this year that aims to make available about 760 million euros for health at European level. There will be 4, as in work program 2021, highly likely we will work with 4 main areas of action. Disease prevention, crisis preparedness, health systems, digital, and the cross-cutting strand, which is cancer. Now, in closing of my intervention, and I would just like to give you some highlights from the first step of the programming for 2022. And I would like to emphasize that we are doing the programming for the policy initiatives in health and not for the research part that is done under DGRTD and Mission for Cancer for this particular topic. So what we have learned from the stakeholders that about 40% of the replies we have received think that disease prevention and health promotion is it needs to be addressed first and foremost. Then the other strands are more or less equally represented, with cancer of about 14%. With regard to cancer, our stakeholders believe that cancer care and combination therapies would require attention. Now, these are not statistics. They don't mean high representation because of the numbers of replies, but this has been a targeted consultation, so each contribution counts on its own. So in brief, this is what I wanted to highlight, the about 1 billion euros that will be available hopefully by the end of the year for different sorts of actions, including cancer and other activities. Thank you very much for your attention.
Thank you so much, Mr. Peres. And I would also like to congratulate the European Commission Director Hudson, yourself, the whole team for the very good proposal for you for a health program and the extraordinary good cooperation with the European Parliament and also with the Council. You remember well, the negotiations were not easy, but the most important initiatives and priorities, cancer included, in the end were saved. And this is something extremely relevant. Before going to Mr. Pan and ask him to moderate for the next 3 interventions, I have 2 questions from the audience. The first question is for Professor Chomien from Mrs. Ioana Bianchi. If Professor Chomien think that countries that elaborate for the first time their cancer plan would benefit from consulting on their draft national plan with the Mission on Cancer Board, if there could be an input, a consulting, support in order to have a good cancer plan. And the second question, and of course I will invite then to answer, is for Dr. Udrea from the Melanoma Romania Patient Association, from Mrs. Violeta Stratinei. She would like to know, you as a physician and manager of a private hospital, how do you see the future of comprehensive genetic testing in Romania? Because at least for the melanoma cancer patient, the genetic testing is extremely important. And also another question for Mr. Peres from Ioana Bianchi. Can you speak a little bit more about the Innovative Health Initiative Program, funding and activities? There is a question for me also, but I will leave it at the end because we still have some interesting presentation. So I start with Professor Chomien, then Mr. Udrea, and then of course Mr. Peres. Professor Chomien, please.
Yes, thank you for the question. I'll make it very clear is that all the members of the Mission Board on Cancer are ambassadors for the member states, and they are really at their disposal to be able to help whatever member state or institution wants to have advice. And so, yes, of course, we would be happy all together or in a specific subgroup or just individually to be able to participate and give advice. And then after that, of course, there are other types of, as Mr. Bassor was saying, of the national cancer plans that can be helped. There's also the joint actions of CanCon and IPAC, who have done also a survey of the different national cancer plan. But we'll be very happy to be at least some stakeholders to participate and to give advice.
Thank you so much, and we'll count on your advice and expertise. And Dr. Udrea, please.
Yes, thank you for your question, Violeta. As of today, we have from pharma companies the possibility to test for the predictive biomarkers, but the question, I think, it's going to next generation sequencing testing, which is more important and comprehensive, and that can eventually go through personalized therapies, which is the future in oncology. As of today, we know that there is no reimbursement for neither of this genetic testing, neither predictive. So I think that this should be on the plan, on the National Cancer Plan. And because is Professor Chomien here, I think that she can talk or say something about the program of testing, of molecular testing in lung cancer in France, which is a big success. And it showed that the fact that we are testing, it's cost effective for these all expensive treatments, which we have also in melanoma.
Thank you so much, Mr. Peres.
Thank you, Mr. Bușoi, and thank you for the question, which is not exactly in my area of competence, but I will try to answer. And I think the question refers to Innofin, which is a EU Finance for Innovators, a joint initiative between European Investment Bank and the European Commission. This is something under Horizon 2020, the cooperation, where financing is provided either directly or via financial intermediary. Early stage enterprises, SMEs, corporates, or research institutions may have access. I hope this was the question about, as I said, it is outside of my area of competence, and my focus is on EU for Health program. Thank you.
Thank you so much. For me, it was a message from Mrs. Dorica Dan, and I thank you for the message. And of course, we have advocated together with Eurordis, the Rare Disease European Association, and for ERN for Cancer to include rare cancers for adults, and they will not be forgotten in the official documents. This is something that we'll make sure together. Thank you so much. I will give now the floor and the leadership and the moderator role to Adrian Pană, Dr. Adrian Pană, one of the best experts in healthcare in Romania, former state secretary, extremely involved in writing the good and right Romanian cancer plan for the future. And he will introduce and moderate for the next three guests. Mr. Pană, please, you have the floor.
Thank you very much, Dr. Bușoi. Indeed, it's a very, very hot topic that it's very actual for the Romanian stakeholders, and that it's making the discussion very, very interesting in order to get the most of the possibilities to incorporate in our local actions. I would like to invite Mr. Matthias Schupp, cancer team leader for the European Beating Cancer Plan Task Force from the European Commission, to provide us the insights, and I'll encourage the assistants to put questions and we'll address them further on. Mr. Schupp, you have the floor.
I'm afraid, Adrian, that we lost for a moment Mr. Schupp, because I don't see him.
Yeah, it looks like. So.
Let's go to European Medicine Agency. Please, you make the introduction and we see. Yeah.
We'll ask Dr. Ralph Herold, the Senior Scientific Officer in the Task Force Regulatory Science and Innovation at EMA, to give us his speech. Dr. Herold, please.
Thank you very much, Dr. Pană, Mr. Bușoi. Thank you very much for giving EMA the opportunity to speak at this roundtable on opportunities for Romania to implement the European Beating Cancer Plan. So I've built my intervention on views presented by our Executive Director, Ms. Ima Cook, to committees of the Parliament, European Parliament, but it has to be considered my personal contribution. And we want to inform you about activities and opportunities to support research and innovation in cancer, as well as access for cancer medicines. Let me start by saying the European Medicines Agency has the primary responsibility for the scientific evaluation and supervision of medicines. And in cancer, this meant that all new active substances are to be reviewed by the EMA via the centralized marketing authorization procedure. And there are now more than 160 new cancer medicines that have been authorized following this EMA assessment in our 26 years of activity. In 2020 alone, there were 11 cancer medicines recommended for approval with a new active substance against cancer. So against this background, I would like to outline some of the challenges and possible solutions that we see from our perspective in the areas of cancer clinical trials, collaboration with downstream decision makers, and support to innovation for cancer medicines. And we hope these points resonate with your considerations for Romania. First of all, clinical research with cancer patients is necessary but challenging, and especially so for the rare and pediatric cancers. There is an opportunity here for the European Union and every member state to optimize the research efforts by ensuring access to clinical trials and facilitating participation in trials when that's considered the best option. For this, we really need to leverage resources for conducting high-quality clinical research in Europe. We fully acknowledge that the patients are expecting to have options to access clinical trials locally. Currently, we see that the majority of cancer trials are conducted in less than a handful of member states and often in only a few number of centers. Thus, there is an opportunity to bring trials closer to EU patients by promoting and enlarging the development of competencies and trial readiness across Europe. Planning of such clinical research needs to be refocused on designing quality into clinical trials, and that includes risk-proportionate approaches and systematically involving patients and a range of other stakeholders in trial design. We and other regulators are progressing this idea through the renovation of the Good Clinical Practice Guidelines in the context of the International Council for Harmonization, ICH. But we also need to encourage and support collaborative clinical trials to leverage a collaboration between local academic researchers with scientists in the regulatory network to address emerging regulatory science questions as well as treatment optimization in cancer. Indeed, the clinical development doesn't really stop with approval or reimbursement. We think of evidence generation as a continuum to refine the understanding of what is really the optimal use of cancer medicines in clinical practice. And therefore, support should be given to clinical research into cancer treatment optimization. And this would look into all important clinical outcomes, into real-world effectiveness, into safety, and would lead to identify the population that is most likely to benefit. This continuation of generating data is necessary to inform the optimal use of medicines and the discussion of choices of doctors and their patients. We would like to suggest to combine these considerations into a high-level practical concept, because we see here a tremendous opportunity to develop what could be called a learning healthcare system. And this would allow to maximize the data generation in the real world by federating data from different sources like clinical trials, health studies, electronic health records, and cancer registries. The challenge is in creating and supporting the right infrastructure across Europe for systematically collecting and sharing key data from these different sources. The European Commission addresses these needs, for example, by creating the European Health Data Space over the next years, and our European Medicines Agency is contributing in particular through our Darwin initiative to this. On the second point, access and reimbursement of medicines, there is a need to maximize the transparency of decisions and the sharing of information with other decision makers. The EMA has established a structured way to communicate benefit risk assessment, and we also have a long-standing experience involving patients in our work. However, we need to continue to modernize the methodologies to include patient views in the benefit risk assessment directly, and how we then communicate these benefit risk decisions. We believe that efficient communication is also needed and will benefit to decrease the time lag that was previously mentioned already, and to decrease the differences between authorization decisions by us regulators and access decisions through health technology assessment across Europe. And this efficient communication needs to start already during the phase of clinical research. For all of this, multi-stakeholder discussions on development plans are a key component to foster the generation of evidence that informs different decision makers at the same time. The recently published strategy to 2025 of the network of all European medicines agencies has a dedicated chapter specifically on access and availability, outlining these principles. Third and last, we need to continue to foster the development of innovative cancer treatments for patients in need. The pharmaceutical legislation and the regulatory practices provide already a number of tools to incentivize innovation and breakthrough treatments in areas of high unmet need. So, for example, innovation offices in member states and the Innovation Task Force at our European Medicines Agency engage with research projects that come from all across Europe to provide the innovators with orientation in the complex regulatory system and with scientific support for further development of their products and eventual translation to benefit patients. Such projects can, for example, be novel types of medicines, novel ways of manufacturing medicines, unconventional ways to administer medicines, but also novel scientific tools to support the development of medicines. Several incentives are available already: small and medium enterprises, for developers of medicines for orphan diseases, for medicines to treat children, and for so-called priority medicines in our PRIME scheme. These and other opportunities allow all regulators in Europe alike to provide additional targeted support to developers for new cancer medicines and also for the development of approved cancer medicines to target important new indications. On the basis of our experience with this development support and assessing the results of these cancer medicine trials, the EMA has published a set of anti-cancer guidelines, and these have become a key reference for efficient cancer drug development. They undergo regular updating and reflect the latest experience and support efficient clinical research efforts, and that's both relevant for commercial and non-commercial sponsors. So to conclude, the EMA is fully committed on delivering the ambition of creating an enabling environment for the development, evaluation, and the patient access to cancer medicines, and we support the implementation of the European Beating Cancer Plan. Thank you all very much for your attention.
Thank you, Dr. Harold, for your well-structured presentation and also for the very practical information. As we heard in the beginning of our discussion, the subject of approval of clinical trials in Romania, it's kind of painful subject. And our hopes is that in the near future, with the new regulation, we're going to be able to promote more and to have, let's say, the Romanian patients to have more access to clinical trials for cancers, which are not only beneficial, but sometimes the only hope that they might have. So thank you once again. And as soon as we'll get some questions for you, I'll be more than happy to put it here. We'll go further. Welcome back to Mr. Matthias Schupert. I'll ask him to provide his speech. He's the cancer team leader for the European Beating Cancer Plan Task Force. And Mr. Schupert, you have the floor.
Thank you. First, can you hear me?
Yes.
Okay, thank you. First, apologies, my Zoom crashed at the worst moment, and it seems that I'm not able to turn on my camera. I hope I can share my screen so you can see at least my my presentation. Is this visible?
Yes. Yes.
Yes, it is.
Okay, thank you. So again, apologies for these technical hiccups. I'm going to briefly present you the Europe's Beating Cancer Plan as adopted on the 3rd of February. And I will give some then special consideration to actions that have been launched or are being launched this year under the EU for Health program. And I will also outline some other funding tools at Commission level that will be available to support action on cancer. As a background, the cancer plan was adopted in February this year, and it has 4 pillars. It's a holistic approach, so we start from prevention via early detection to diagnosis and treatment and quality of life of cancer patients and survivors. And we have a number of cross-cutting themes like research and innovation, digitalization and personalized medicine, inequalities, and pediatric cancer. The plan itself consists of 10 flagship actions and 32 other actions that cover the entire cancer control continuum. It includes also lessons learned from the COVID-19 impact on cancer patients and care. And the Commission has committed to an overall budget from different funding instruments, the main sources being the EU for Health program, but also Horizon Europe, to make available a budget of 4 billion euro to address cancer action. Now moving on to the flagships and the actions in detail. In the area of research and innovation, the Commission has already launched a Knowledge Center on Cancer. So this was done at the end of June 2021, with a view to synergize and coordinate on all ongoing EU actions in the area of cancer. The Knowledge Center is based at the Joint Research Centers, which has already a track record on working on cancer, for instance, through the European Breast Cancer Initiative or on the European Cancer Information System, and also some other areas. Then next year, we will be launching a European Cancer Imaging Initiative with the view to use modern technology, artificial intelligence, to improve cancer imaging and diagnosis. Other areas of actions include, for instance, also making security accessible and sharing patient data through the European Health Data Space proposal, or expanding the already mentioned European Cancer Information System to cover more indicators, for instance, on the quality of screening, monitoring screening programs, but also on staging of cancer at the stage of diagnosis. Prevention, again, holistic approach covering very many areas and different areas, with a flagship for HPV vaccination for girls. 90% is the target here, and to substantially increase the coverage of vaccination for boys, with a view to eliminate cervical cancer and some other cancers caused by HPV. Other actions in the prevention area, update of the existing European Code Against Cancer, and improving the knowledge and dissemination, creating a tobacco-free generation, a focus on reducing alcohol consumption, improving healthy diets and physical activity through the Healthy Lifestyles for All initiative, which is incidentally being launched today by Commissioner Gabriel. Action to improve air quality and reduce emissions. And also ongoing actions, for instance, to reduce workers' exposure to hazardous substances. When we look at early detection, the flagship here is a new cancer screening initiative, or screening scheme, an update of the 2003 Council recommendation on cancer screening, for which the Commission will make a proposal in 2022. This will not only be an update of the existing coverage, so the Council recommendations currently cover breast, cervical, and colorectal cancer, and we will also consider extending it to potentially other cancer sites. Then quality assurance schemes for colorectal and cervical cancer, done by the Joint Research Centers, which have already gained experience through working on breast cancer. Here, developing guidelines for diagnosis and treatment, and rolling out now a quality assurance scheme. And this will then be followed by the similar initiatives for colorectal and cervical cancer. And then the European Cancer Imaging Initiative that I have already mentioned earlier. In the area of diagnosis and treatment, a number of flagships. First of all, the creation of national comprehensive cancer infrastructures or centers. This links also to the work of the Horizon Europe Mission Board on Cancer, where Professor Chaumian presented earlier, and is one of their recommendations. And besides creating and support to these national comprehensive cancer centers, also creating EU network, so to facilitate EU collaboration in this area. Then an initiative on cancer diagnostic and treatment. Here, with the view to make available cutting-edge technologies in terms of diagnostics and treatments, for instance, using liquid biopsies, etc., to all EU citizens, again, by networking and disseminating this knowledge across the EU. And then another flagship, also part of the mission on cancer, Horizon mission on cancer, the Junkan initiative to better understand cancer, the initiation, how it spreads through the body, which will be important basically for all the pillars of the cancer plan and all the pillars of the Horizon cancer mission. Other actions, interspecialty training program of health professionals, the establishment of new reference networks on specific cancer types. This builds on the experience that we have with the existing system of European reference networks, which however focus only on rare diseases. And there we have already 4 networks that focus on rare cancers. But we also want to use and utilize this experience to address now more common cancer types and cancer conditions. Last but not least, in the area of radionuclear medicine, the Samira Action Plan, which has been adopted already on the 5th of February and is now implemented, which looks at the quality and safety of radionuclear diagnosis and treatment, but also at the supply of radionuclear isotopes, which is also under challenge already before the pandemic, but the pandemic has again shown the importance of safe supply in this area. Coming to the last pillar, the quality of life for patients, survivors, and carers. Here with the flagship that will focus on a cancer survivor smart card and the establishment of a European Patient Digital Center, which will be taken forward under the Cancer Mission of Horizon Europe. And other actions on fair access for cancer survivors to financial services, the so-called right to be forgotten, and full implementation of the directive on the work-life balance for parents and carers. Now, when you look at the cross-cutting issues, the inequalities, we are preparing the launch of a cancer inequalities registry to basically map and see trends in cancer across the EU and across EU regions to develop and inform then investment decisions at EU level. Telemedicine and remote monitoring, virtual consultation, and diffusing the virtual consultation model of the European reference networks. This is basically in response to the lessons learned from COVID to make health services safer for cancer patients, which are often immune suppressed and for whom it is quite a big risk if we have, like in pandemic times like this, if they have to go to healthcare establishments and which might increase their risks. So possibilities for cancer patients to have remote consultations, follow-up, etc., without having to go necessarily to healthcare establishments. Also, in a more general vein, reinforcing European health systems for cancer care in future crisis, also response to the pandemic, and then equality action that goes across all areas of the plan. Last but not least, the area of childhood cancer, a particular chapter in the plan with a new initiative to address childhood cancers, establish a new EU network of youth cancer survivors, and again, as part of the mission on cancer, an action to address childhood cancers in adolescent and young adults. Now, since the adoption of the plan, we have also set up a governance mechanism for the plan. Besides the European Parliament, which has the Beating Cancer Committee, which was already established last year, we have established 3 additional groups. The first one is a member state group, which brings together experts from the health and the research ministries under the umbrella of the Steering Group on Health Promotion and Disease Prevention, and which will advise and monitor the implementation of both the cancer plan and the cancer mission. Secondly, a cancer plan implementation group. This is at Commission level, a so-called inter-service group, to ensure that all actions and policies at Commission level are aligned and feed and synergize with the cancer plan. And last but not least, a stakeholder contact group. This is for the wider stakeholder community under the EU's health policy platform, also to discuss and exchange on the implementation of the plan. Now, as Adrian already mentioned, we have already launched a number of calls under the work program 2021 of the EU for Health program. And the first wave, which was launched in July and finished on the 15th of September, we addressed 4 topics: quality and safety of radiation technologies for cancer's diagnosis and treatment, then the update of the European Cancer Information System, with a new segment to monitor better cancer screening programs, then the interspeciality training, and the EU network of youth cancer survivors. There will be a second wave, which we understand should or is planned for mid-October, which will focus on HPV vaccination, the update of the European Code Against Cancer, addressing liver and gastric cancers caused by infections, supporting the Healthy Lifestyle for All initiative, supporting the rollout of quality assurance schemes for breast cancer diagnosis and treatment, then advanced cancer diagnostics and treatment, which I mentioned already before, this new initiative, initiative on drug repurposing, a cancer treatment and capability mapping that shall feed into the work on the comprehensive cancer infrastructures, and also the Cancer Survivor Smart Card. In addition to these calls, which are basically open to all stakeholders, we have also launched calls for joint actions, 4 of them. One on comprehensive cancer infrastructures, another one on setting up an EU network of expertise. So basically these European or these reference centers on more common cancers and cancer conditions, on HPV vaccination or supporting member states for HPV vaccination, and then the health-related deployment of e-health and telemonitoring service in response to the lessons learned from the COVID crisis. Perhaps at the end of my presentation, just very cursory to flag also other EU funding programs that have either calls for cancer or can be used for cancer action. The Horizon Europe program, and at its core also the Mission on Cancer. The Digital Europe program, Erasmus+, the European Institute for Technology, the Marie Sklodowska-Curie actions. These are both at EU level, and then we have funds that are jointly managed between the EU and the national level. The cohesion policy funds, for instance, where member states are in the driver's seat. So basically here it's up to member states to define their priorities and for which actions they wish to use the funds available to them. And besides these 3, these 3 cohesion funds here, also to flag the technical support instrument, which will not fund actions per se, but funds technical support. So we have, for instance, already the experience or the example of 3 EU member states that are working together to implement cancer screening. And the technical support instrument provides basically the technical expertise to the member states to implement these actions. So perhaps in a nutshell, to the end of my presentation, and happy to answer questions. Thank you.
Thank you very much, Mr. Schupe, for this presentation. On one side, it's amazing to find out that there are so many initiatives that we can be part of it. On the other side, I'm thinking of it's a lot to catch on our first national cancer plan, but it's important that there is already, let's say, a broad expertise from several member states that have been through this process for several years, and also the fact that the European Commission right now it's providing such a vast array of initiatives might help us to fit better in what we have to do in the future. We have a couple of questions for Mr. Harold, and also feedback. The representative of the Romanian Patient Melanoma Association, she wants to thank you for the instructive presentation and fully agree that both academic and pharma clinical research need to be supported in order to provide more therapeutic options to patients and also to play a role in the drug optimization. They want to see that enforcement of research and development of cancer and cancer treatment registries will be seriously considered in our national cancer plan. The two questions that I have, one is from Mrs. Bianchi. Does EMA have a reflection on how to capitalize on the COVID-19 vaccine approval experience for approval of cancer medicines? Specifically, do you think rolling assessment could be extended to oncology medicine assessment? This is the first question. And the second one, it's from Beatrice Costa. Would you like to provide EMA personal perspective with regards to potential collaborative review programs designed to ensure fast oncology drug regulatory clearing in Europe, similar to Orbis initiative initiated by FDA? So, Mr. Harold, whenever you are ready to answer to these questions, we're more than happy to hear you.
Thank you very much. And these are indeed interesting questions that are being raised. And thank you also for the second question, understanding these are personal views. And I need to stress this just because these things are evolving. Just briefly, yes, we're still in the middle of the pandemic. We still have at the European Medicines Agency a very high workload in dealing with new COVID medicines, and the reflections and lessons learned, of course, are being started, and there is a reflection. What does it mean, not just for COVID treatments and for pandemic treatments, but also for other therapeutic areas? I have no summary at this point in time, but clearly we are dedicated to further develop the regulatory system. The agency has published last year the Regulatory Science Strategy 2025, and this is a comprehensive set of ideas how to improve regulatory science and the regulatory system. That was before the pandemic has hit us hard, but certainly all these lessons learned during the pandemic will go into these reflections and will be used for improving the regulatory system. The other question was about collaborative reviews, and I understand internationally collaborated. And here I would like to say that currently we already have, and we are in Europe, the model of international collaboration to evaluate medicines and provide access. Europe is the starting point of how member states have come together and share their views on medicines in the assessment. And we have then 27 member states plus Norway, Iceland, who contribute and bring in these views in the CHMP, the Committee for Human Medicinal Products, on the authorization. So we are already a model, the prototypic model, if I may say, for this. In addition, of course, we have extensive exchange and collaboration with other agencies across the world. In particular on cancer, there are every month cluster meetings where over a time of several hours, many issues in the assessment of cancer medicines are being discussed internationally. And the purpose is, of course, to overcome hurdles, to understand the data, and to see that the medicines decision on medicines can be taken with the best possible understanding of the data. So in that sense, I think we are already in a good place, and having these collaborations in place ensures that there is an understanding of global alignment. The legal frameworks are different outside of Europe, so within Europe we have already the international collaboration, as I mentioned, that where Romania is clearly also playing a role. I hope that accommodates your question and the drive behind.
Thank you very much. I would like to invite now Mrs. Ilaria, Janico, the representative of European Union private hospitals, to give us a speech about the topics. And also I would like, in the end, after all the presentation will be given, to kindly ask you to summarize, each of you, up to 3 main points that you consider to be essential to be taken into account for drafting our national cancer plan. So, Ilaria, you have the floor, and then we'll try to summarize and have the final round of discussions together. Thank you.
Thank you. Thank you very much. I hope you can hear me well. Okay, great. So my name is Ilaria Giannico, and I'm the Secretary General of the European Union of Private Hospitals. If you're not familiar with it, it's the European Association representing private hospitals in Europe. We are based in Brussels, and we basically represent the interests of the private hospitals towards the European institutions. We represent more or less 5,000 clinics in 17 countries, and we see Europe as a whole. So our members are even outside the EU, like in Switzerland, Monaco, Serbia, Moldova, Russia, etc. Pound, which is one of the organizers of the event, is our member for Romania. So thank you very much for the invitation, and also for bringing so many different stakeholders around the table on this important topic. I don't have a presentation because I will be mostly sharing some considerations, let's say, from the private hospitals and the private sector on cancer. So first of all, we think that we need solidarity to fight cancer in Europe. The objective is to develop coordination projects to limit the incidence of cancer and improve the well-being of European citizens. And for this, a collaborative process is required. We need coordination between all actors, policymakers, administrations, professionals, and providers, because all forces must converge towards efficiency and quality of care to our common patients. We advocate at all levels to include the private sector as a regular partner to develop positive solutions and share our experience in the healthcare sector. Inequalities in health, including life expectancy, are still today painfully evident among all the EU countries and are not improving fast enough. The statistics on cancer deaths in Europe reveal this deep, sad, and unfair situation. But a common solution to break down the persisting cancer, I would say, iron curtain, is the actors' convergence towards the same goal by using public health strategy, financial investments, and provider coordination. Improving the quality and the access to healthcare and increasing life expectancy by promoting a healthy lifestyle will be possible thanks to the strong cooperation between public and private healthcare, but also thanks to the policy measures directed to investments in social protection, expenditure. In 2020, I'm sure you know way better than me, 2.7 million people in the European Union were diagnosed with cancer, and another 1.3 million lost their lives to it. Over 40% of cancer cases are preventable, and mortality can also be reduced through earlier diagnosis and the provision of more timely and effective treatment. So we join the call that I've been hearing during this this event for a stronger prevention. You might think that this goes, let's say, in opposite to the interest that I represent, but no, this is really not the case, because it's not because we are private hospitals that we want people to be hospitalized at any cost. We know that prevention can be beneficial to everyone, to the patient and to all actors all along the chain, the healthcare chain, the healthcare pathway. But we all know that the COVID-19 pandemic has severely impacted cancer care, disrupting prevention and treatment, delaying diagnosis and vaccination, and affecting access to medicines. So since the pandemic began, the number of cancer diagnoses has decreased, foreshadowing a future increase in cases, and we are already seeing it in the hospitals. In addition, the number of lives lost to cancer in the EU is expected to increase by more than 24% by 2035. I'm sure that you know all those data better than me. So we need to do something. Also, the overall economic impact of cancer in Europe is estimated at more than 100 billion per year. So it's a huge, huge amount of money that affects all the healthcare systems in Europe. So this situation should be addressed with a multi-pronged approach, including public health recommendations, national and regional screening programs, and new treatments. For us, for UEHP, the goal is to develop new services adapted to the population needs, but without a clear commitment to investments, to workforce training, to equipment upgrading, there can be no solution. And the current situation is no longer acceptable, and the challenge is to turn good intentions now into action. So in this context, we very welcome all the different initiatives that were presented by the European Commissions and the other institutions during this event, the EU for Health program, the Cancer Mission in Horizon, and we very much welcome the Commission's initiative to create the Cancer Inequalities Registry this year to identify trends, disparities, and inequalities between member states and regions, because we need to identify disparities and barriers if we want to benchmark them and if we really want to achieve a common approach to the cancer disease. We all know that cancer incidence and disease expressions are dependent on multifactorial contexts, like the environmental conditions, prevention, screening, access to diagnosis and treatments, the medical follow-up, which is also very important, the social protections, but all these conditions, and certainly more than those, are necessary to fight the disease, and the economic factor is not the least important. We need to take into consideration that health expenditure statistics show a huge range of differences among European member states, and health expenditure, what is health expenditure at the end of the day, is the attitude that each member state has to reach the universal coverage. So this should really be something that we really need to bear in mind. On the private hospital side, I don't know how familiar you are with the sector, but we represent 40% of the European market, with like 22% of for-profit hospitals and the remaining part of not-for-profit hospitals. From 2010 in 2018, the number of all hospitals beds fell by 5%, while the decrease in the private sector was just 1%. So we can see that the future of healthcare, of the healthcare sector, must include private hospitals, which are the only, I would say, one of the only growing healthcare sector in the EU, and the national governments have to understand that the private hospitals are defined by the European institutions as providers of general service. Why? Because we serve the entire population, so we are complementary to the public system, and for us the patient is one, the patient is common, so we really want to be part of it, and also on the cancer in the cancer fight, because we are here and we are delivering, and we want to deliver more. So we really need to foster collaboration, to have more initiative based on the practical experience, and to be assessed by investors that could provide an opportunity to complete health provisions. So in the cancer disease, experts must interact with all the caregivers to define the best treatment for each patient using a multidisciplinary process. We can and must break the barriers and fight the silo approach, where each intervention now is carried out in isolation. So based on medical projects responding to strategic incentives with coordination of providers without any statutory constraints, new solutions can be developed. All future medical projects should be collaborative, as European patients now require access to expertise and not only to local access. So in cancer treatment, as well as in other disease, the solution is to aggregate competencies. So to conclude, we know that the complexity of the situation, and we are here to support all the initiatives from the EU, all international initiatives, and all the events like this on how we can translate European policies into member state policies are very much welcome, because as other colleagues were saying before, it's a lot. Europe is doing a lot, but maybe not everyone is aware, and on the side of the member states and on the hospitals, on the national healthcare system, is a lot to take in. So it's not always easy to find a way between throughout the different initiatives. Private hospitals are delivering, including in the area of cancer screening and treatment, and can deliver more and in a more extensive way. I really want to stress that. But yes, innovative solutions from prevention to treatment of severe conditions require coordination. We have to base our analysis on facts and figures, and to build a common perspective for everyone, for all our patients and all citizens in the EU, and to try to narrow all the unacceptable gap between the different member states that unfortunately we still see in 2021. That was more or less what I wanted to share with you, and I will be happy to take any questions. Thank you.
Thank you very much, Ms. Janico, for your speech. You're completely right. So the patient is one, irrespective of how health system it's constructed, public, private, mix. So I think for the cancer patient, it's very important that the services that are provided to be provided timely and also in a coordinated fashion. So without fragmentation, and this is one of the main problems that we're facing, at least in Romania. The patient pathway for main cancer problems, it's very fragmented. So, and of course, we know that this is impacting on quality of life and also on survival. Mr. Baciu, the state secretary, is apologizing for not being able to join us for this meeting. He's still retained at the minister office for a meeting related to the pandemic. So in the end, I would kindly ask you to provide, if you have, let's say, one suggestion or a couple of suggestions for our first national cancer plan. I'll invite first Mrs. Kulcha to give us an advice if she can.
Thank you very much, Dr. Juana, and thank you everybody for such inspirational speeches. If I am to select just 3 out of so many things that I have heard today and that I would recommend to be implemented as soon as possible, it's very hard to stick to 3, but let me try on that. I would say probably one of the most important thing is to finalize the elaboration of the patient journeys to at least the 10 most important oncological pathologies and include that into the National Cancer Plan. I think it's quite difficult today to be a patient with cancer in Romania, not knowing exactly where to go, how to approach, when, and to whom to discuss. So that would be extremely helpful for everybody, not only for the patients. Secondly, I would say not only to accelerate, but even to introduce new screening programs for cancers, and of course to allocate adequate financing and monitoring mechanisms. You know, at the innovative industry level, we have these days amazing scientific progress. It's delivering innovation across so many areas of high unmet medical need. But unfortunately, we know that for the cancer patients, every day counts. So if we are not able to improve the access to innovation, that would not help them. And I would say it's just a simple measure that we at the political level, we need to take to improve that access, at least to provide clear terms for the updating of the reimbursement list and prescription protocols, which sometimes takes ages until we publish them. And last but not least, to speed up the approval of the clinical trials. That's another source of hope for the Romanian patients. Thank you so much for the very high quality of this event, for the very high quality of the speeches. And I am absolutely committed with the RPIM behind to support in any way I can the fight against cancer.
Thank you very much, Mrs. Kulcha. We'll go to Mr. Hotterbock.
So I would like to put the point on screening programs and also on early detection of new cases. I think preventing is much more cheaper than treating the cancer. So I think once we are here, everybody, I mean, at the European level, and also in Romania, we started some screening programs on some other diseases, but in the cancer disease, I think only a few things were done. So now it's time to move things forward. Also, I want to tell you that we should integrate more the private hospitals and clinics in the screening programs, because we have the capabilities, we have the facilities, we have the equipment, we have the specialists to work in preventing these new cases. Also, we have the people that are working in curing the disease. I mean, you know, in Romania, the radiotherapy in proportion of 80% is in the private sector. So I think this is the main focus that we have to come out from this meeting, screening programs and prevention. I want to thank you also very much for the presence. Ilaria, thank you very much for joining us. As you know, we are also a member of the European Private Hospitals Association, and Ilaria is the General Secretary of the association, and we are very proud to be members of this association. Also, I'm a member of the board, so we work together in order to implement new healthcare policies at the European level. So thank you very much, everybody, again.
We thank you, Mr. Hotterbock. Dr. Woodra?
Yes, I selected three big ideas that I would like to see them implemented in our national plan. First is to have a real national registry, which means obligations from all oncology services to report data, because I think this is the baseline for a cancer plan. Second is to finally adapt at least European Society of Medical Oncology guidelines, which includes everything: screening, diagnosis, treatment, biomarkers, and follow-up. And third, some kind of real professional quality control from oncology professionals or done by oncology professionals. I thank you, everyone, and I was happy to be today on this, and I hope that I contribute with my knowledge with things that can be for the future. Thank you.
We also thank you. Further on, I would like to invite Professor Chomien to give us some ideas.
I cannot, of course, answer precisely for the Romanian National Cancer Plan. Therefore, that's why I think that it's important to identify clear actions that really answer the patients and the citizens of Romania. So I think all national cancer plans cannot be identical. They need to be clearly adapted to the needs. So once again, I stress that these needs need to be defined by the patients and the citizens themselves. Once again, the commitment of all the stakeholders, public, private, whatever they are, for these actions, they have to be a signed commitment of all the stakeholders that they want to have a solution for these actions. And at least I believe that a successful national cancer plan needs to combine at least the Ministry of Health and the Ministry of Research.
Thank you very much. We'll go further to Mr. Schuppe.
Yes, perhaps considering the strong focus of the cancer plan on inequalities, I would perhaps mirror the comment already made by some of the panelists that the strong, or let's say a challenge for Romania is certainly in the area of screening. And I'm very pleased to hear that, let's say, already some of the pieces of the puzzle are in place. They just need to be put in the right place to work, or in the right order to work. Secondly, to underline that indeed, and we understand it's sometimes quite difficult to navigate, let's say, the maze of different EU programs, etc., make full use of the existing programs. And in that respect, I think it's already a good sign that the Romanian authorities have expressed an interest to participate in all 4 joint actions addressing cancer that we are launching this year. So I think this is a very, very positive sign, and also consider other funding programs that might be of help, like the technical support instrument, for instance, that could provide technical expertise when implementing the cancer plan or developing the cancer plan in Romania. Over.
Thank you very much, Mr. Schuppe. I have also a question from you, from the audience, and I would like to read it right now. As mentioned, we miss criteria to define how good quality cancer care is looking like in Romania, and in our cancer patients have no idea that what hospital and clinic they need to address for their care. Considering the European Cancer Plan, is there any guidance that is developed at the EU level in order to assist the member states to define centers of excellence and specialized cancer care, besides the one produced by the European Cancer Organization? The question is asked by the representative of the Melanoma Patient Romania Association.
Yeah, this indeed is one of the objectives of the action to support member states to implement comprehensive cancer centers nationally and their EU networking. So this is work that is now, building on what we already have. We have already certain criteria, but we are now working with all the member states to define a system that is on one side flexible enough to accommodate different existing systems, but also to ensure that we can deliver high quality care to cancer patients throughout the EU.
Perfect, thank you. We'll go further to Mr. Adrian Perez.
Thank you. As the previous speakers have mentioned, a plan without actions is not a real plan, but action without financing will not work. So what I would like to emphasize and to invite the participants and also the other stakeholders in this meeting, that to follow the opportunities that we are offering through the EU for Health program. Like Matthias said, collaborative action is very important, and the participating in the joint actions, it is really offering the opportunity to share best practices and go beyond that. And last but not least, I would invite participants to follow the national focal point communications in Romania that would highlight information related to EU for Health program and also disseminate the results. Thank you.
Thank you, Mr. Perez. I do hope that Romanian authorities will actually have the possibility to absorb what it's on the table right now, because there are a lot of opportunities. So I pray for, let's say, increased capacity to absorb the funds. I'll go further to Dr. Harold.
Thank you for the meeting and the ability to speak here. And we shouldn't advise as EMA on the National Cancer Plan. And it's just a single personal reflection I thought may be interesting. And it is related to what we are doing at the EMA. And this is to acknowledge and to strongly enable the primordial relationship of patients and oncologists. With this needs time, they need compassion, they need a multidisciplinary team. And the relation to what we're doing at the agency is the following. Our agency does not recommend one medicine over another. We do not regulate treatment pathways. We provide authorized medicines that are options to be considered. And therefore, we rely on an informed relationship between patients and their health carers. And of course, national cancer plans will build a system for regulating access, but still in all of this, there is this primordial relationship that we need to have as the fundamental basis for the trust in the overall system, but also the informed choices and making the patient part of the center part of all our endeavors to beat cancer. Thank you.
Thank you very much. Any final comment from Mrs. Janico?
Yes, if you ask me to pick three recommendations, not only for Romania, but for all member states, I would say, first of all, to secure cancer budgets as a critical enabler for improving continuity, efficiency, sustainability of cancer care. Second of all, to foster cooperation among all actors, as I was saying before. And third, more involvement of the private sector. And thank you, Christian, and thank you, Paul. Thank you, everyone, for this wonderful and very, very interesting event.
Thank you. I thank you all for this productive discussion. I hope that we'll have an opportunity to meet again and to bring in front of you results of our cooperation. And now, for the final word, I would like to hand over the mic to my colleague Cristian Bușoi. And I thank
you so much, Adrian.
Once again.
Thank you so much. I had to leave for 10 minutes the meeting to negotiate with Mr. Pascal Canfin, the MV chair, Fit for 55 package competencies. But thank you so much for being present. Thank you to the audience. Thank you to the Romanian stakeholder. And thank you very much to the guests from European Commission, from European Medicine Agency, from Mission for Cancer, and of course from the private hospital association. It was a very useful exchange of views, a lot of useful information, a lot of opportunities. Of course, on some of them, we have to expand a little more and to discuss a little more in depth in the future here in Romania. And of course, we need to build a correct, good and efficient Romanian national cancer plan in order to succeed. So thank you so much once again, and we stay in close contact. Cancer is a high priority at the European level, and it's a good momentum to make a significant change for Romanian patients and for European patients also. Thank you so much. All the best.
Thank you very much. Goodbye.
Thank you. Goodbye.
Bye. Thank you.
Bye. Bye.